dental hygienist Ashley Paxon. She joined the Clinica staff in 2012 and works at East Medford Dental Clinic. A Central Point resident, she is a 2011 graduate of the Oregon Institute of Technology in Klamath Falls. Ashley is a native of Gold Hill. On her days off, Ashley can be found outdoors, either hiking or rafting the river, mountain biking, or playing volleyball with her friends. Her favorite trip was 2 weeks working in Guatemala as part of through Mercy Corps and Medical Teams International. She was very excited to become part of the La Clinica dental team and work closely with her hometown community, providing quality health care to all who seek it. Hygienist Maria Rios worked for La Clinica as a dental assistant in 2009 and 2010, then returned to the organization in 2012 after earning a hygiene degree. The Medford native works at the East Medford Dental Clinic. She earned her associate degree in dental hygiene from Carrington College in Boise, Idaho. Maria and her husband Albert have 2 children, Tito and Annie. They enjoy hiking, fishing, camping, and spending lots of time with the family. I'd like to introduce Maria and Ashley.
So we're going to start with a video, and it's about 7 minutes, and it's just going to give you an introduction of who we are, what is La Clinica, and what we base our organization on. So it'll be a little bit informational, a little emotional, kind of give you an idea of what we're all about. So I think we have our speakers set up loud enough here.
I came to Oregon in 1994, in January of 1994, and in April found out that I was pregnant with my first child. My husband at the time was a seasonal worker, and he told me about La Clinica.
Before La Clinica, we all used the emergency rooms. And when we were sick, then we would go to the emergency rooms, which was out-of-pocket expense for everybody, and then we heard about La Clinica. We spread the word.
The building in itself didn't look like a clinic. It looked just like a house, I remember parking in the gravel parking lot and I go, this doesn't look like a real, I was suspecting a medical facility, but it looked very rural, like it's just a clinic in the middle of nowhere, by the railroad tracks.
It was the spring of 1989. Rain Man won the Academy Award for Best Film. Gas cost $1.10 a gallon. In Switzerland, a scientist developed the world's first web browser. And in a little building next to the railroad tracks in Phoenix, Oregon, La Clinica del Valle Family Healthcare Center opened to its first patients.
An outreach worker came to a middle of the orchard where I used to live and offered services and not only transport me from my house to the clinic, back and forth for my appointments. That was such great relief because I didn't have a driver's license. I didn't speak the language. I didn't speak English very good. To have somebody come to me in the middle of an orchard and take me to an appointment and offer these services, it was just like, wow, I want to do that sometime.
Jackson County was home to 140,000 people as the 1980s drew to a close, about 4% of them Latino. Many Latinos had come to work in the Rogue Valley's orchards. The team, including the late Hank Collins, then head of the county health department, saw the need for health care for the new residents. A health center known as Clinica Azteca faltered shortly after it started, but supporters rallied again and reorganized into the beginnings of the La Clinica we know today.
It was a very busy place, but it was small, and because there were so few employees, maybe a dozen, 15 at the time, we were really like family. And we could actually make decisions as a group.
In the early days, Williams and physician Deborah Gordon, La Clinica's first medical director, struggled to find staff qualified to care for a growing load of patients. Paul Rosticus soon signed on along with Patrick Wedlake, Miriam Soriano, and Jim Shames, now Jackson County's medical director. Shames recruited Birkenstock-clad friends from the Tacoma People's Clinic near Cape Junction.
Some of them had very long hair, long beards, Birkenstocks, blue jeans. We would put a white coat over them, and I can remember seeing certain young pregnant women looking up with just fear in their faces when somebody with this very long beard and long ponytail would come out, and that's what's going to be their doctor or their nurse practitioner for the day. So it was always very interesting watching the interactions between the clientele, the patients that we had, and our staff.
With its location a few feet from the railroad tracks, the building presented challenges as well.
the folks who were in charge of scheduling knew not to schedule certain procedures at certain times. Procedures like vasectomies and such didn't want to be happening as the train would go by because the entire building would shake for a good 15, 20 seconds. So this would happen a couple of times a day. But we knew, and we had it marked in the schedule book, so that that sort of thing hopefully would not be happening when the train would go by.
La Clinica was growing. Williams wanted to add a dental service but couldn't figure out how to fit it into the little clinic, and doctors were running out of room to see patients. Soon, La Clinica decided to ask community boosters Dennis Barr, Gary Miller, Bill Williams, and the late Jane and Dunbar Carpenter to serve on a committee to raise money needed for construction of a new place to provide care. At more than 15,000 square feet, their dream seemed almost impossibly grand. A fundraising campaign started in 1994, and the building now known as Phoenix Health Center opened in 1996. It included space for a future dental service.
It was very large. I mean, it was just put on a size pants that are 5 sizes too big. It's going, I'm never going to grow into this. And we did very quickly, really. It made you feel valued. And I'm sure the patients felt valued. And that was the important part.
La Clinica grew in those years in ways likely unnoticed by patients. In 1995, a newly minted nurse named Brenda Johnson joined the staff as a diabetes educator. Brenda was named interim director in 1999 and in 2000 became La Clinica's CEO, leading the organization through its biggest changes yet.
And I'll tell you, I think the board took a big risk on me. I really do. I was young and a new mom and extraordinarily passionate about the work.
La Clinica began to open school-based health centers, launched a mental health program for uninsured patients, and opened the West Medford Health Center. By 2004, dental staff was visiting schools with the Happy Smiles Dental Prevention Program, and in 2005, La Clinica added certified nurse midwives to its prenatal staff and specialized services for women. Central Point Health Center and the Women's Health Center opened in 2008, followed by the 34-chair East Medford Dental Clinic and La Clinica Mobile Health Center in 2012.
What I realized is that how efficiently they were evaluating where they were needed, places where they were needed, and locations where they were needed. And I thought it was really incredible and very professional in the aspect of very caring, because they were actually targeting and focusing on the needs of the community.
From the beginning, the organization has worked to serve patients' needs, but as the final pieces of the Affordable Care Act became law, that focus grew even stronger. La Clinica's primary health centers were recognized by the state for patient-centered care in 2012 and by the National Committee for Quality Assurance in 2013. Today, as La Clinica celebrates its 25th anniversary, the organization that started as the tiny migrant health center near the railroad tracks in Phoenix is an essential and thriving part of the community, providing more than 1 in 10 Jackson County residents with essential health services.
Without a place like La Clinica to come to, hardworking low-income families, Anglo or Hispanic, they're not going to have an easy time of getting any kind of service because it's simply unaffordable.
La Clinica is an integral part of the puzzle that really creates a stronger economy.
And I think that the community sometimes doesn't realize what a big role La Clinica has taken on over the years, but if you really look at the numbers, it's really staggering.
I understand that, if you are discussing some major healthcare initiative, La Clinica needs to be at the table. Or maybe it was the one that started that innovative healthcare initiative.
I feel so grateful, to be part of something that's as special as us.
As it looks to the future, La Clinica celebrates community supporters, patients, and most definitely the many people who have served as employees and board members. Their contributions and dedication have made all the successes possible.
So we have a lot of information in here. The majority of our presentation is going to focus on child-centered care because that's where it all starts. We're all about the prevention, getting that first line of defense on the teeth. So a little bit of everything. You'll see a lot of stuff about kiddos, so we can pass that on to those who know. So our overview, again, we're going to review different diagnoses of the mouth, things we often see in the clinic. We're going to talk about what is a bacterial infection, how do we get a cavity, why are the teeth so important, why do we need to keep them healthy, different things, drug use, oral cancer, different things that we look for in the mouth, and then on to the children and ways we can prevent these things.
So here is an image of a healthy mouth. There is no cavities. Gums don't bleed. The gums are very firm and pink, and that bacteria is present, but is controlled with consistent health habits. And this image shows what we call gingivitis. So it's mainly inflammation of the gum tissues. With this, there is bleeding is present, and it is reversible at this point with proper hygiene habits, and it's the bacterial infection that's causing a lot of the inflammation.
So with periodontitis, this is the next step from the gingivitis. Usually the gums will take on more of a purplish, dark pink effect. There's always bleeding involved with gingivitis. People often complain of sore or achy gums. There's bone loss involved, so if you look at the bottom picture, you can see in the radiographs that bone takes a nice dip underneath the tooth. That's not a healthy thing. It's also a bacterial infection, a much more involved type of bacteria, one that's much harder to get under control. Increased risks of it can be a genetic problem, lots of different things we look at in this case. Now, what is a cavity? A cavity is caused by, again, bacteria. So it's specifically called Streptococcus mutans, or we just call it a strep bacteria. Bacteria, they sit against the gums and the teeth, and if they're not brushed away frequently, then they continue to build. They produce an acid byproduct, and that acid byproduct is what eats away at the enamel on your tooth. And so that's how it all starts. So the acidic levels against the teeth, they wear a hole in that enamel. That's your cavity.
So bacteria infection. The body naturally contains bacteria, so we have good and bad bacteria. Most of it's harmless, but if we are not treating it properly, it can become very progressive, very aggressive towards our gums and our teeth. When bacteria from food and plaque and calculus, it's what we call tartar, and it tends to build up underneath our gum tissue and then kind of works itself all the way up to your teeth, creating some very serious infection on our gums and our teeth. The immune system will try to attack the infection, but the underlying buildup, like I was saying, underneath the gum tissue, if it's not properly removed, it will progress and worsen. And why healthy teeth are important. Plaque and calculus on teeth increases the risk of developing cavities, gum disease, gingivitis, periodontal disease, often comes along with dental pain, can interrupt someone's school, work, even sleeping. Dental decay cavities, it makes other teeth more susceptible. So even though if you're a young kid with your baby teeth and they do have cavities, it can be passed down to your adult teeth as well. So without teeth, it would be very difficult to eat, to speak, to chew on certain things.
So there's a relationship between the oral health and the entire body. And the way we bring that together is just by a few examples. With periodontal disease, if it's an active infection in the mouth, it can affect pregnancy. So someone who is expecting, they have an increased risk of having a preterm delivery or a low birth weight baby, which can cause many other issues. Periodontal disease with cavities and how it affects diabetes, it can affect the uncontrolled blood sugar levels. So a lot of times someone who's diabetic, we see really high ratios and it bounces a lot with blood sugar. This increases their risk of infection. So, with diabetes, we're always worried about something not healing. The gum tissue is involved in that as well. Also with HIV and AIDS, which we don't see so much in this area, but it is a concern. They develop more lesions, and so these lesions in their mouth are less likely to heal. There's an increase in bacterial growth that's hard to get under control a lot of times. So it's all connected.
So
Oh, go ahead. Bacteria can also spread throughout the bloodstream. And so you think about it, you have this in your mouth and you're constantly swallowing. If your gums are bleeding, then it's getting into the bloodstream as well. So it increases your risk for heart problems, cardiovascular disease, including endocarditis. So the same bacteria that we find in heart problems, it's the same thing that's found in the mouth. So stroke, atherosclerosis, so the clogged arteries, we find the same bacteria in that plaque buildup. So all connected.
So now we're going to go and talk about oral cancer. So smoking cigarettes, using chewing tobacco products, alcohol consumption are the main cause of about 75% of oral cancer cases. Oral cancer can be found in the head, neck region, both inside and outside of the mouth. It involves the tongue. Early signs of oral cancer could be white patches, red patches, or a mix of both white and red patches. It could be on the roof of your mouth or on the side of your cheeks. It begins painless, but then eventually you'll start feeling like a burning sensation, and it just tends to start growing, and that's where the symptoms of hurt and pain will start. So these are images of what oral cancer looks like. So the white patches is what is also known as leukoplakia, and that's mainly found like along what we call
Vestibule.
along the cheek. And then the red patches, the erythroplakia, is on the top of the roof of your mouth. And then you could also have a mix of both on the inside of your cheeks.
So this is just a short timeline to give you an idea if you were to consider quitting smoking, what you could look at. So within 20 minutes to 15 years, the improvements are vast. I know you can't read from where you're at. So just a quick example, at 20 minutes after quitting, the heart rate and the blood pressure drop back to normal levels. That's within 20 minutes. At 15 years, the risk of heart disease, it can actually equal that to a non-smoker as long as you have quit completely at that point. So quite a big difference there. So if anyone were concerned and wanted to quit smoking, or if you know people who might want to quit smoking, we actually at La Clinica, we offer quit cards. And what it is it's a group in Oregon that is devoted to helping people to quit smoking. They offer different, nicotine gum, patches. They offer guidance and counseling just to get you to that point. So we do have quit cards with us. If anyone's interested, we can hand those out. Visible signs of drug use. So that's a big one in our valley, unfortunately. We see a lot of this. This is just the basics of meth mouth. You can see from the top there's lots of cavities all the way down to the bottom. In this photo, the teeth actually start to meld together from all of that drug use because it's such a harsh chemical that the enamel can't hold up. So pretty sad to see.
And these images, these are other images of cocaine use. A lot of the rotting starts from the base where the margins of the gum is, and then there's the marijuana, the staining on the inside, mainly on the inside of your teeth. And then excessive alcohol, it tends to look like a very dense look, almost like translucent of your enamel. So those are just a couple of images of, that we sometimes see in our clinics. So transmission of bacteria. So bacteria in the mouth is associated with decay, bacterial infection in the gums, periodontal disease. It could be spread to partners and children by kissing, sharing utensils, straws, sharing toothbrushes, cleaning a baby's pacifier with your mouth. We do see a lot of that in our clinic where they are unaware that you're passing down your bacteria onto your children.
So with young children, we have what's called early childhood caries or cavities. These are young, 1 to 3 years old. These children need healthy teeth. They need them, again, to pronounce words correctly. They're learning how to speak at this age. They need to be able to sleep comfortably, enjoying school without the distraction of dental pain. So for many, many years, dental pain, it's actually been the #1 cause of a kid to miss school. They stay home because they have a toothache. And so it's a big problem. the teeth also maintain those spaces. So as their adult teeth are forming, they need to know where to go. And the baby teeth actually hold, it's like a space holder for those adult teeth to come in properly. So it also reduces the risk of adult cavities and future dental problems. So as we'll speak in later slides, our baby teeth, they will actually, if they rot down enough, the decay will actually get to the adult teeth before they've even erupted. So it can be pretty important. Looking in the child's mouth, what we look for are what's called a white spot lesion, and that's just the beginning of a cavity. So as you can see in the top pictures, there's just little white rings here and there. That's the starting cavity. That's something that we can monitor, and if it doesn't get worse, then it will be okay. But once we get to the brown spots that you see on bottom, those are full-blown cavities. So those we have to treat.
So how babies are exposed to cavities. When a baby is born, it's born without any bacteria in the mouth. And again, from what I was saying earlier, how it's transferred over to, it's kissing, cleaning the pacifiers with your mouth. They even say blowing on food to cool it off can also pass down bacteria. Biting pieces, sharing spoons and forks for eating, sharing toothbrushes with parents or siblings, babies sticking their hands in their mouth. Bacteria that is transferred into the mouth stays in the mouth, so it doesn't go away. Once you have it, you have it. So it makes your teeth more susceptible to cavities. Early childhood cavities, like she was saying earlier, it can be predisposing for factors for adult teeth. So it could start having problems at a very young age and continue on as adults. One thing that's very important about baby teeth, that as soon as you notice a brown lesion, to get your child in there and get it fixed. The sooner it's fixed, the better the outcome is going to be for that tooth. Sometimes people tend to wait and they think, oh, it's just a baby tooth that's going to fall out. A lot of the times our children don't tell us exactly what they're feeling, if it's painful, or if they're not able to eat, or they tend to lose an appetite, or they're not active as they should be. But again, like she was saying, their teeth are there to maintain a space for your adult teeth. So we need to make sure that we do take care of those baby teeth.
So leading on from that, oral hygiene in kids, toddlers. Prevention, again, it's the most important thing. It's what we stress the most, because if we can keep it from happening, then we're best off. So again, this starts before the tooth comes in. Just because they don't have teeth doesn't mean they can't have bacteria in the mouth. So wiping the gums after they eat, after they have their bottle, just gently wipe them off with a warm washcloth, anything like that. It's very helpful. They're not able to effectively brush and floss at this age either. So until they're about 8 years old, or even a little older sometimes, they need their parents. So we encourage the children to learn how to brush, but ultimately the parents have to be in there to help. Children, they'll lose their baby teeth again, but the environment will affect the permanent teeth. So again, we don't stress that enough. It's just so important to keep those nice and clean. So some suggestions, don't put a baby down for a nap with a bottle. A lot of times they want their formula, they want juice, they want anything that they can get, and all of these sugars in breast milk, formula, cow's milk, juice, anything you give them, it's going to pool around in the gum. It's called baby bottle rot, which is what you see in this picture here, and it's a very prevalent thing. So again, wiping down the gums can help, taking that bottle away before they go to bed. It's very, very helpful, and if we just make a habit of this, it'll make the difference.
So here's some other suggestions. Maybe giving water in their bottle if that's something that they're not willing to let go just quite yet. Introducing them to a tippy cup or a sippy cup. Sippy cups do not use that suction motion, and it's more intended as a cup, so less fluid when they're drinking is pulling on their teeth. Now they're recommending to forgo the sippy cup and completely start with just a little normal cup at the age of 1. So brushing tips and techniques. So a lot of the times, when we emphasize to children is brushing twice a day, morning and before bedtime. Ages from 0 to 2, they can just use a little simmer of paste on there is needed, and from ages from 2 to 4, it's a pea-size amount that is recommended for that age. Go ahead.
So at first, the kids don't like to have their teeth brushed. You know, we've all seen the screaming battles, probably experienced it at some point. The best thing we can say is don't give up. You know, it's going to be a struggle, but if you encourage it over and over again, eventually they're going to give up and they're going to learn. Make it fun. You know, you can do silly songs and dances. If you go online and just Google or go onto like YouTube, you can find lots of fun routines to make brushing exciting for the kids. Encourage them to brush by reading a book or watching a different movie about brushing. You know, just make it exciting for them. They're going to be more willing to work with you. We also have a technique that we often use at the dentist, and it's called lap-to-lap technique. And it does involve 2 adults, so you have to be able to work with that. But what you do is you have the child straddle one person around the belly, and then you lay their head back into the other person's lap. So as you can see here, now the person who has the head in the lap has a little more working room. So you can lightly squeeze the cheeks. You don't want to squeeze too hard, but it'll kind of help open that mouth up. A lot of times in the office, we try to make it fun for them so they're not afraid to come back, but if their mouth is wide open and they're screaming their heads off, then we're able to do what we need to do. So as a parent, if they're going to scream, you know they're going to scream. Just go ahead and brush those teeth anyways.
So here again, not a happy camper because of brushing. So brushing, you know, could be a torture for kids at times. But just remember, you know, you would rather have your child screaming because they don't like their teeth to be brushed versus that they have a cavity or they're in dental pain. So it's very frustrating for a child when, you know, he doesn't want to cooperate, and as a parent, you just want to get in there and brush. But just remember to be very patient and to kind of make it enjoyable for them so that they can be more open to it. So pacifiers and thumb sucking. So it is recommended to wean a baby from a pacifier by the age of 2. Pacifiers can cause what we call buck teeth, which is on the right side, where their teeth are flared out, or an overbite where their mouth is kind of open. And they have a lisp while talking also. So it does interfere with the natural development of their teeth. And so there's also suggestions on what you can do. Many children, you know, that love to use pacifiers, you can use a natural reflex to. When using a pacifier, if you're going to use one, choose one that is recommended by an orthodontical one that is approved, that the dentist will allow.
It's an orthodontically shaped pacifier,
Yeah.
and the dentist made it so that it would help with the alignment of the teeth. So those large, just the old-fashioned round pacifiers, they actually interfere with the teeth, but this one's designed not to interfere. Different ways to kick the habit. So we all have the thumb suckers and the pacifier kids that they don't want to give it up. We can offer rewards and encouragement towards quitting that habit. You know, there's different ways. We don't like to go to this, but there are finger guards. It's just a plastic guard that blocks the finger, so they don't get that ultimate reward of sticking the thumb in the mouth. Those can be a little expensive, so a little less expensive is the bitter nail polish, or some parents like to do Tabasco. And you just put it on the thumb that they're most likely to suck on, and that will take care of it as well. There's also more fun ways to do it, which we encourage first. So again, there's books like the Goodbye Binky, so you can read that and then they understand why they're letting it go. Or you can give it to the Pacifairy, so kind of like the Tooth Fairy, they put it under the pillow one night and then they receive something in place of it. Cold turkey, again, that can be a little more frustrating, so you can try it if you like, or just gradually taking it away. Only give it to them at certain times.
So fluoridated supplements are a great way to prevent dental decay for children. It's a natural mineral found in some water supplies, food, medicine, often in toothpaste and mouthwash. Fluoride makes the children's teeth grow strong, and as they're forming, it also helps. So in Southern Oregon, there is no fluoridated water. But they have known to see that where there were areas of water fluoridation, it does decrease the dental decay that is found. There are fluoride supplements that we start children from the ages of 6 months to 16 years of age. They can come in liquid form or tablet supplements. And then if you follow the directions properly, there is no adverse reaction that can occur.
Okay, so on to the dental visits themselves. What we do with the young ones, we do a happy visit. They're a wonderful way to introduce the kids to the dental office. They're usually done from 1 to 3 years. The dentist will teach the parents the lap-to-lap technique. The goal is to be fun, enjoyable, so we just kind of keep it lighthearted. If there is an immediate concern, then we'll address that, but otherwise we just keep it exciting. Regular appointments for adults and children alike. We recommend annual x-rays, so once the kids get to an age we can do that, and then all through adulthood. New x-rays, they find dental concerns, so we can't always see them with the naked eye. Cleanings will be scheduled on the individual needs, so if you're one of those high-risk patients, you'll see us more frequently. Other work, fillings, crowns, extractions will typically follow after those cleanings. So we always like to do the cleaning first, so we're putting a filling on a nice clean tooth. It'll last longer that way.
So daily prevention again, brushing twice a day. Most toothpaste already come with the ingredient of fluoride. Making sure that you're replacing your toothbrush every 3 or 4 months. Using a soft toothbrush is recommended. Flossing at least once a day, preferably before bedtime. And then using mouth rinse as well once a day will help also control and lower that bacterial level in your mouth. So nutrition. So again, snacks such as cookies, candies, and cakes are obviously not a very good choice for snacks for our teeth. But however, you can just it's the amount of how much you're taking in. It's the frequency. So it's okay to have them once in a while, but also making sure that you are maintaining good hygiene, brushing your teeth, and just making sure that it's nice and clean. There's other foods like cereals, chips, and crackers, and even dried fruit that we wouldn't think would be bad snacks, but are also susceptible for cavities.
The end. Any questions?
Do you guys have an opinion on the mechanical toothbrushes? I just started my 7-year-old using a sonic chair, and she seems to brush a lot longer with that.
Yes.
Did you feel it?
That's the one we actually recommend. I have a Sonicare in my home, and I prefer it. It's a lot better because it goes that full 2 minutes, so the kids automatically know once it shuts off, okay, we're done. So we should be brushing that whole time. The one concern we see with it is a lot of people get a little sloppy and lazy with them. So, they think, oh, the toothbrush is doing all the work, and then they forget to do half the mouth because you still have to move it over those teeth.
Well, she was doing that with the regular toothbrush anyway. She just stick it in her mouth. Like,
Now you gotta move. Yeah. So yeah, they're a great option, and I have one that I swear by it. I don't think I could go away from it for a day. So, yeah.
Thank you.
Absolutely. Thank you. Thanks for hanging in with us there.
You guys